So I worked with hardcore drug addicts for 12 years in Vancouver's downtown east side. People really dependent on cocaine, crystal meth, heroin, fentanyl. Well, actually fentanyl came along after I left medical practice, but opiates, heroin,
Yes.
codeine, Dilaudid, and so on. If you look at the physiology of the opiates, they work in the brain because we have receptors for them. But then you say, well, why do we have receptors for something that comes from a plant in Afghanistan, the opium plant? Well, we don't. We have receptors for our own internal opiates. So human beings have an internal opiate system. And those opiates are called endorphins. And endorphin means endogenous morphine-like substance. Now, why do we have endorphins? Because they're essential for life. Number one, they're pain relievers. So the so-called placebo effect is not placebo at all. When people perceive they're getting help, their brains will release endorphins, which will then kill the pain.
Okay, right.
So
I see it.
So it's not an empty imagined effect, it's actually a physiological response. So pain relievers, physical and emotional pain, both. So we have to have pain in life. You and I both agree. Without pain, we're not warned about what's dangerous, but we also have pain relief. So that's the endorphins. That's the first thing they do. I'm talking pure physiology here.
Okay.
The second thing they do is they modulate experiences of pleasure and reward, elation. Now imagine how dark and dull life would be without pleasure and reward. And the endorphins give us that. That's the second thing they do. And the third thing that they do is the most important thing they do, and we've been talking about the whole day, which is attachment.
Attachment, yes.
So they make attachment possible. Now, when you speak to heroin addicts, and I've done this repeatedly, and say, what does it do for you? One of them said, first time I did heroin, it felt like a warm, soft hug. What was she talking about? Love. Another guy said to me, oh, heroin, doc, it's like you're sick and you're shivering with a fever and you're 3 years old and your mother wraps you in a warm blanket and gives you warm chicken soup. That's what the heroin feels like. They're talking about love.
Yes.
Who gets prone to heroin addiction? The people who didn't get the love they needed as children, and they're lacking the endorphins. Now they need to get it from the external opiates. So it's a normal response to some deprivation in childhood.